what company people have been told me to present. But definitely it's a very interesting topic which we should know about it. And what I have seen that we have a lack of knowledge regarding obesity and rest of the things related to obesity in our state. Because हमारे साथ एक concept है कि obesity मतलब हम तो खाते पीते खानदान के उनसे बीमारी को मानते हैं. What I will start presenting and what I will show in my presentation that it is a disease. And if you consider obesity as a disease, definitely you will get to know that what it can be. And this is what I'm a bariatric metabolic and robotic surgeon. I'm also a bariatric endoscopist, and I'm happy to share that I was invited as a visiting consultant bariatric surgeon at Victoria Hospital, Seychelles, East Africa. I was working as a consultant bariatric and metabolic surgeon at Mohak Bariatric and Robotic Center in Indore under Dr. Mohit Bhandari, and also working as assistant professor at Saints Indore as well. So my first mentor is my father, Dr. Nirupam Sinha, and Dr. Mohit Bhandari and Professor Dr. Manuel Galvanito, who is supposed to be called as the father of bariatric endoscopy in the world. So this is my place where I'm working at present. This is the place I just wanted to share some of my pics from Victoria Health Clinic, Seychelles, where I was working. I was invited to become a bariatric surgeon over there, where I performed 5 surgeries as well. Starting with my presentation, I'd like to show a few seconds reel of a surgery which I performed over there. So this is Victoria Health Clinic where I performed my surgery over there. Very visit with a great team, great OT setup, and great management. All the patients were so happy and no complications, and all the patients recovered very well over there. So I just wanted to show my starting slide with this about the minimally invasive surgery which we performed over there. So coming to the case mix disclosure, independently I operated more than 3,000 bariatric surgeries at Mohak Bariatric and Robotic Center, and as a team we have performed more than 25,000 bariatric surgeries over there. We have been named as a world record holder for performing 62 bariatric surgeries in 13 hours. And this is my case with disclosure where we performed not only sleeve gastrectomy but rest of other surgeries also, including endoscopic sleeve gastroplasties and balloon placements as well. So starting with my topic, this is obesity worldwide. This is a data which is of basically of 2016, which shows 2.1 billion, or nearly 30% of the world's population is obese or overweight. Rise in overweight and obesity is up to 36.9 overweight, and obesity is up to 38%. Now, countries with most obese people are United States first, China, India, Russia, and Brazil. और हम हिंदुस्तानियों की एक आदत होती है कि हम लोग हमेशा दूसरे कंट्री को बीट करते हैं किसी भी एस्पेक्ट में, चाहे वो तरक्की हो चाहे किसी भी. So I'm sorry to say that we are beating China also. We are about to beat China in obesity as well. So my objectives for the discussion regarding the definition of obesity, causes, associated conditions, classifications, management, surgical and non-surgical approach both, and a few instructions about the anti-obesity medications as well. So starting with the definition of overweight and obesity, we all know about the basic things. Just I want to summary up. About the BMI classification, that is called as body mass index, is a measure of body fat based on individual's weight and height, calculated by weight in kgs by the square of height in meters. And BMI normally classifies into underweight, normal, overweight, obese class, and obese class considered of classified as obese class 1, class 2, and class 3, depending upon the ranges of the BMI. What health implications of overweight and obesity can be there? So you name it and you will have it. It's like start from top to bottom, from head to toe. So I will show you my next slide as well. Overweight and obesity are associated with a range of health issues including cardiovascular, diabetes, certain cancer, musculoskeletal disorders. And these definitely conditions can result in decreased quality of life, increased mortality rates, and increased healthcare costs. So something about body mass index. I've already told you that it is divided, it is calculated by division of weight upon the height. BMI alone does not diagnose health. Definitely it does not diagnose health alone because BMI is the only thing. It's like you are sitting here, you can calculate your BMI if you know your height, if you know your weight. So that is the most common tool which we use to tell that the patient is overweight, obese, or in underweight. It's a convenient rule of thumb used to broadly categorize a person as based on tissue mass like muscle fat and bone and weight. High body fat may lead to heart disease, stroke, and type 2 diabetes. Underweight classification I have told you. Underweight is less than 18.5. Optimum range ranges from 18.5 to 24.9. Overweight is 25.20 to 29.9. Class 1 obesity is 30 to 34.9. Class 2 is 35 to 39.9. And class 3 or above is called as morbid obesity. So this is the body mass index. Now there are two basically types of obesity, like what we have seen in patients. One is Apple or Android type, and one is Pear or Gynoid type. So most of the males basically used to consist this kind of obesity, which is called a central obesity. Females normally used to have Gynoid or Pear type obesity, which normally includes excess body fats on the thighs and the buttocks region. So if you compare between Apple and Android, and if you ask that which obesity is much more dangerous, so I can tell you that this central obesity, the Apple type or Android type, used to have significant correlation with metabolic syndrome rather than this Pear or Gynoid type. So definition is like the theoretical part. Obesity is defined as chronic relapsing multifactorial neurobehavioral disease, wherein an increase in the body fat promotes adipose tissue dysfunction, abnormal fat mass, physical forces resulting in adverse metabolic, biomechanical, and psychosocial responses. Now, starting with the prevalence and the global impact of obesity, the worldwide statistics on overweight and obesity, it is very concerning that overweight and obesity have become a significant global health concern. Now, according to WHO, the parameters in 2016, it shows more than 1.9 billion adults worldwide were overweight and over 650 million adults were obese. This was the consensus of 2016. Now you can imagine how much it got increased up to 2024. I'll show you the statistics of India as well regarding the obesity factor. How it can lead to economic and social consequences. Definitely the global impact of overweight and obesity extends beyond health illnesses. It definitely presents significant economic burdens due to increased healthcare costs, reduced work productivity, and the impact on social welfare system. Now, we'll start with some of the basic statistics which will definitely alarm you regarding the obesity pattern and the obesity rise worldwide. So, the global estimate 2020 and the projected number of adults up to 2025, what they have suspected. That adults with overweight, that BMI more than equal to 25 to 30, up to 2020 it was 1.39 billion, and what they are expecting up to 2035 it will be up to 1.77 billion, and the obesity it will be up to 1.53 billion in 2035. And adults with overweight and obesity as a proportion of all adults globally up to 54%. So that definitely is a matter of concern which we should think about it at present.